now we're going to move on to hearing from Kim Willett. She is a nurse practitioner practicing in the Hartford area. She belongs to the Community Health Center. And we wanted Kim to talk to us today because, you know, as you heard from Kate Yoon and others, I mean, this really took a lot of effort from community and people who had never seen refugees before, and took a lot of basically people to pitch in. And we wanted to hear from somebody who was sort of like just starting this, you know, without having done this, and what was the experience like, and what could we learn from people who are doing that, because there might be people in this audience who sort of, you know, want to get into this and know how to initiate something new. So that's why we wanted Kim to come and speak to us. So I'll stop there and turn it over to Kim to tell us her experience.
Awesome, thank you so much. Perfect. All right, let me just, you know, sometimes it doesn't matter how many times you practice, you always struggle a little bit with Zoom. 2 years into the pandemic and we're still struggling, but that's a-okay. All right, perfect. Well, we'll just do it this way. So again, my name's Kim. I'm a family nurse practitioner, and I work at the Community Health Center. And this year I'm a Center for Key Populations Fellow. So a little bit of background information about everything that's going on. You know, I don't think I have to hone on this too much, but as we all know, in August of 2021, this is really the time where the Taliban took over the capital of Afghanistan, over in Kabul. At this time, the government switched, and there was a switch of the control of power, and we saw tens of thousands of individuals fleeing the country, not just the United States, but around the world, really to seek refuge, to seek safety for themselves as well as their families. A little bit of background of information about, you know, who we are at Community Health Center, where we are, what we do, all of that. Community Health Center Incorporated is a community health center. Really our mission and our goal is to help those who are underserved. Our main principles and values, the motif that's present throughout the clinic is really that healthcare is a right and not a privilege. We use the best that we can integrated healthcare models and systems to achieve holistic care for all of our patients throughout the state of Connecticut. A subset of Community Health Center is the Center for Key Populations. And our goal is really to deliver care for those who are experiencing severe healthcare disparities, to help those who are suffered barriers to healthcare. And with everything going on, you know, at the Center for Key Populations, we got a phone call as well, and we said, you know, let's help out, let's do what we can and do the best that we can to start a refugee health clinic for those who've come to the state of Connecticut. And it's really incredible to hear the stories about the families that were in the airport and at the different bases, and then to kind of tie it together to see those families now in the community setting. So I hope that this kind of paints a picture for all of you. So the beginning and where we started, November 13th, 2021, this was our first clinic day. We had a grand total of about 12 patients on the schedule. We did tons of preparatory work, and I think all of us went into clinic and said, let's get there a little bit early. We'll be done by the early afternoon. There's 12 patients on the schedule. This will be a great day. We got to clinic around 6 a.m. and I don't think we left until about 7:30 or 8 o'clock that night. There was just everything, you know, no matter how much preparatory work we did, we couldn't anticipate what was to come. As a new healthcare center that was doing this new clinic, we did the best that we could. We made templates in the electronic medical record system to try and standardize the best that we could to really ease the process. However, we quickly realized that we really can't create templates. Everything is different based on the countries and the individuals that are coming to clinic. We knew we would have to utilize the language line interpreters to assist in translating. However, with the different dialects, and this had been touched upon as well, there simply weren't enough interpreters. Wait times were very long, and we were on the phone for up to an hour and a half just waiting for someone to assist us with Pashto. We assisted with transportation for the different families to and from clinic to ease the process the best that we could. Throughout the clinic day, we wanted the families to stick together, realizing that many of them have just been through incredible circumstances, and we didn't want to take one in at a time. So we set the clinic up for Friday, and we had 2 families come. However, with this being said, as people in refugee health know, those initial visits are very, very long, lots of things to touch upon, and it created a very long day, especially for the small children. We had ordered labs and wanted everyone to get a good health assessment first, but however, the lab closed because of the amount of time we were there. Post-clinic, we had the lab review, and we have a structure at Community Health Center to give the patients a call back. However, there are a few barriers, and again, people in refugee health know you get flooded with labs, and it was just a very, very long time. And many people throughout the state of Connecticut probably know my name because I was wrapping my head around what to do with the stool samples, what to do with parasites. And this is an area that we were just really working with, and a lot of debrief. So this is a little bit about the very beginnings of our clinic. Where we are now, so we still are working with a Saturday structured clinic. The idea of this is so we can allow the families to come to clinic and have the children hopefully not miss too much school as they come in, and as we had been talking about before, so the whole families can come together. We're really utilizing the language line services, and I can't emphasize this enough, is reserving them ahead of time. There is a shortage of staff, and especially on the weekend days, it can be challenging. So we've been calling and reserving as many interpreters as we can to assist us throughout the clinic day. We're getting the patients to get the labs done right away. We know the basics, and I know there's a few questions in the chat earlier about titers. We're getting those titers ordered to just get the things done, going, and all set. As we had also touched upon before, there's a huge lack of dental care as the patients have come in. We're seeing dental abscesses, we're seeing cavitations. So at that first visit, we're really getting the patients linked to our dental home. And luckily enough, at Community Health Center, we do have a dental team, so we're able to link them up to care on that first day. No matter what we do, the visits are going to be long, especially when we're bringing families of 6, 7, 8 individuals. So what we've done is we've arranged for food donations and clothing donation drives for the families to peruse as other members are being seen for their medical care. We have rooms of games, and we have some volunteers just playing. We have food, of course, halal food for the families to kind of make it a little bit of a healthcare event, these Saturday clinics. That first visit, we automatically have every single patient come for a follow-up visit in 2 weeks. That allows for enough time for all of the labs to be reviewed, enough time for us really to debrief and analyze what each and every patient needs and kind of create an individualized treatment plan for each patient. That second week of follow-up visit is when we're able to do the well-child checks, the annual adult physicals. And at that second visit, we can kind of figure out a little bit of an understanding on if the patient wants to continue with primary care at Community Health Center, and we can get them into our clinics, or if they're going to choose elsewhere, especially based on location. The Saturday clinics has been very, very nice to allow for continued to follow up, especially for those more complicated cases. We're able to touch base and have frequent follow-ups for individuals with latent tuberculosis. We're able to open the clinics for the nursing schedules to do catch up at the best that we can. As had been touched upon in previous slides and other presentations, is there are some acute and chronic needs that really need close follow-up, some interesting infectious disease cases that come about that require very, very close monitoring. And so we've been trying to link the patients the best that we can. These Saturday clinics also allow for us to really stay in tune and do a routine health maintenance the best that we can. Last Saturday, we held a women's health clinic for our female patients that have come and established with Community Health Center. And for a lot of these individuals, it was their first women's health visit ever. So it's pretty incredible to see this. And I'm sure that these stats have changed since I put these slides together, but so far we've had over 200 patient visits, 28 dental visits with the different families. And while 13 seems like a small number, I find this to be a huge victory that we've had 13 behavioral health visits just to really work on those behavioral health needs since the start. We as a new refugee health clinic have faced many challenges along the way, and we're still working on them daily. Transportation needs, and as had been touched on before, navigating the bus route system, which has been very, very difficult. I know some individuals are applying for driver's permits, and it's so exciting to see. I had a female in clinic the other day who was so excited when she was taking her driver's test. She had called her dad from Afghanistan while she was still in the driver's seat, and unfortunately they made her do it all again, saying you can't talk on the phone in America. So it's been exciting to see, because she said, I would never have been allowed to do this in Afghanistan. We've been utilizing different transportation services throughout the state of Connecticut to help allow, such as VEO, to help allow easy transport to different visits, not only with us, but with specialists if needed. We've been working closely with the pharmacies. This has been a huge challenge ever since the beginning. How patients can pick up the medications, how do they get to the pharmacies? There's just this huge language barrier that we've all mentioned. And can we get the medications delivered? If the family member isn't home, where can we send them? So this is something we're still working on, with very close coordination with the pharmacies has been paramount. We've been definitely struggling a little bit with communication, but working very closely with Iris and Siri to assess for different ways that we can communicate with the families while they're at home a little bit better, especially when minutes on the phone have run out, or phone numbers have changed, or family members have the phone now. So these are all things that we're working on. And we're working very closely with the local education systems, really to touch base about the vaccine catch-up, really to provide education to the different resources in the Hartford area about latent tuberculosis, the need for chest x-rays before we can get the kiddos to school, but to get them to school as soon as possible. So while these are all challenges, these are things that we're going to continue to work on in the near future. So elements for success. I wanted to just label this slide title collaboration and communication, because that's the key thing. Collaboration is so important for these families, and is so important in refugee health. Like I was saying before, we spoke to different pharmacies to get cost of coverage for medications covered if the Medicaid status is still pending. However, somebody needs something imperative, like an inhaler or diabetes medication, how we can get the medications, especially in the beginning time while the families are still getting acclimated, delivered to the house, instead of having them to have to go to a pharmacy, find the pharmacy, and just eliminate that process. We've been coordinating very closely with the different partner agencies in Connecticut, including Iris and Siri. This is paramount. Really, even if there's a family that we're not able to get a hold of, or if we want to touch base, I used to send a weekly email that I think everyone was dreading on that Monday morning about all the things I wanted to get done this week, but it really helped kind of smooth everything over and get ready for the next week and get everything settled. It's been so important to really coordinate with the subspecialties. As we talked about, there's going to be different things that come up, rheumatic heart disease that we don't see commonly. We're going to see different infectious diseases, and to really coordinate with the individuals at different subspecialty offices throughout the state to get their thoughts, their perspectives. Can we manage this outpatient? Would you like to see them in person? And next steps. Getting them into dental care. Most of the patients that we've seen have never seen a dentist before, so as soon as possible. And like I said, we try to get them initiated at that first visit into our dental care system, just to establish a dental home. And behavioral health, and I can't speak about this enough, but this is something that we do address at the first visit, but continue to, and really to coordinate with the local, behavioral health specialists to try and integrate it as much as possible to seek help for those. We coordinate with the local school systems, as I had mentioned previously, and of course, other refugee health clinics. And I appreciate being here so much. I've already learned a ton, and can't wait to implement different resources that we've heard. So communication is also a key for success. I talked about the weekly Monday morning emails that I'd send at about 5 a.m. But we've also implemented weekly meetings with our staff. This is an opportunity to debrief about the previous week, things that we want to touch on at this upcoming Saturday clinic, how we can work together to really kind of overcome the challenges that we've been facing in clinic. And I've been so lucky to be able to attend monthly meetings with community members and state invited by the Yale Refugee Health Clinic. And it's just been such a wonderful opportunity to speak together and really to grow as a community in refugee health. It is such a niche, but it is manageable, it is doable with the help of others. And I just want to finish by saying, it's more than just a medical form. It's more than just a medical visit. It's a first contact For some individuals, this is the first contact that they've ever had with medicine. This is the first time that they've been able to have a medical provider, a primary care provider. It's a time to promote healthcare advocacy. And I totally agree. And I love my anecdotes, but sometimes it really helps solidify it. As I said, I had a women's health clinic last Saturday, and it was most of the women's first time ever having a women's health visit. And I had a woman, and I was explaining the process of a pap smear and cervical cancer screening. I was demonstrating it, and she said, am I able to say no? And I said, of course you can say no. Our job as a medical professional is to educate you as to why we recommend or don't recommend something. And I said, would you like to not do it today? Would you like to think about it? She goes, of course I want to do it. But I just wanted to know if I could actually say no. And to me, this was so empowering to tell a female that she can say no. It's her right. It's absolutely okay. And as we were doing the breast exam, she placed her hand over mine and said, I want to learn how to do this too. And so it's really a time to advocate for our patients. It's a time to utilize and gather as much information as we can to promote the ease of a transition into a new country, whether that be with housing, whether that be filling out a WIC form to just provide a little extra assistance, to provide a support system, whether that be collaborating with the other families in the local area and getting everyone together. And it's an opportunity to be a confidant to these patients and to really be more than just a medical provider, but be there for them in every sense of the word. So I just want to thank you all so much for having me. I'd be happy to answer questions, but it's been an exciting journey for us, and I can't wait to see what comes.
Thank you so much, Kim. This was fantastic, and it's inspiring. It's amazing to see how much you guys have accomplished, and it's only just been a few months. It truly is incredible. So thank you for sharing your story, and especially sharing some of those challenges, because I think it's really instructive for all of us to just sort of think about how one might overcome those barriers. What's been really exciting is watching the crowdsourcing that's happening in the chat with people adding sort of new resources as we're going. So thank you.